I will try to speed up now. So the second question.
Sorry, just time.
Yeah, okay, vaccination in Portugal. And I will give you just the background. I will give you the background for the second part of the talk. So in Portugal, there were 3 waves of COVID-19. Vaccination started at the end of December 2020, as in many other European countries. And the government still is struggling to choose the right mix of measures to keep COVID under control, but to allow for some social and economic activity. And in this specific study, we wanted to answer the question as what will be the impact of vaccination on the transmission dynamics, and more importantly, when and which control measures can be relaxed as the vaccination is rolled out in 2021. So for a very long time after the new year and up until very recently, then Portugal was in lockdown. It's yet one lockdown. And the question is, well, how this lockdown must be lifted and when it must be lifted, and as the vaccination proceeds. I think that's what everybody wants to know. And I included here some of the references. That's the first is a reference by Professor Matt Keeling from Warwick University and his collaborators. They address a very similar question for the UK. And also there was a report in mid-February published for the UK by the Scientific Advisory Board for Emergencies, also on the roadmap for relaxation for the UK. Of course, there are also other people who work on this topic. So if you're doing this, you can email me, and maybe, I don't know, maybe we can learn from from our studies if you're doing something for other country. So the model we use is quite similar to the previous model. It was simplified, so we have only one infectious compartment. We also distinguish among people who recover after having mild or no symptoms and those who recover through the hospitalization. So this H and R boxes, they contain all individuals who have recovered, and the H contains all those who have been hospitalized at some point. And then we have vaccination. And for the vaccination from each compartment, except for the I, you can go in the respective vaccinated compartment from S, E, H, and R. So this is in accordance with the guidelines in which you can be vaccinated irrespective of your disease status. So if you're not actively ill and if you don't have any big issues, then even if you're in exposed state, for example, you can also be vaccinated. And R is the vaccination rate, and the vaccination rate is age dependent. And we assume was the most recent based on the most recent data, we assume that the vaccine may have 3 effects. One, first of all, it's transmission blocking. It has transmission blocking properties, and these properties are implemented as a reduction in the susceptibility of individuals who are vaccinated. As you see, that's beta, the susceptibility, is reduced by some factor, which depends on the vaccine efficacy in reducing susceptibility. Moreover, we assume that vaccine efficacy in reducing infectivity, and it can also be, there is some vaccine efficacy, so the infectivity of individuals who get infected despite vaccination can be lower than the infectivity of individuals who are just naive and get infected, so who didn't have vaccination. And finally, vaccine, of course, has a high efficacy against hospitalization and death, which is implemented as a reduction in as a reduction in the hospitalization rate nu. And as before, we use the same structure. So that's the extension of the previous model. We have 10 age classes, and here we keep on 10 hospitalization classes and vaccination classes, the same 3 susceptibility classes. And well, based on the data, we group to compare with the seroprevalence for only 5 classes. And we use again the 2 data sets, which is the same, the hospital admissions and the serological data. And the hospital admissions, it's almost 28,500 hospitalizations for nearly a year that we have now. So it started from 2nd of March until the mid-January. And we fit the model, the most of the procedure I already described in the first part of my talk. The contact patterns for the Portugal, they are also used from the data. So there is a Portuguese specific contact matrix, which was published in by the group of Alessandro Vespignani in Nature Communications in the beginning of this year. So we used the contact matrix before the pandemic from that study. The contact matrix after the pandemic was inferred based on our Dutch data. We inferred it for Portugal because there were a lot of similar measures introduced in both countries. In particular, the schools were closed in both countries. And that's how the contact rates declined for Portugal. If you look, for example, that's the number of contacts in a given age group. And you see that it's, of course, before the pandemic, so that's called baseline. It was largest in school children. But after the introduction of the first lockdown, the contacts were reduced and the number of contacts became almost flat. So there was reduced very much for the younger age group, but to a much smaller extent, the contacts were reduced for individuals who are above 70 or 80 plus year old, because these individuals already have most of the contacts that are essential to them with the medical professionals or with family members who take care of them. And I think most importantly in this work, we estimate how this contact structure changed throughout the whole period of the pandemic, and we estimate when it changed. So that's an example. Before I showed you one logistic function about how this transition happens from before to after the lockdown. And here I show 5 estimated transitions that we have. First transition, it's occurring roughly, around March, April. And this was introduction of the first lockdown, and different trajectories correspond to different parameter estimates. Then after the first lockdown, some of the measures started to be relaxed, and the relaxation started somewhere in May. So that's, we estimate the second transition in the contact matrix when the measures were relaxed. Throughout the summer, it stayed nearly the same because not many measures were changed throughout the summer. Then at the end of August, beginning of September, the schools started to be open, and this also fueled the change in the contacts in the rest of the society, because when schools open, actually the parents apparently also have to move quite a bit. So that was another transition that we estimated. This transition after the schools opened, well, I don't say it's a causal relation, so the causal relationship, but the second wave started in Portugal, and in November there was another emergency. On the 5th of November, there was another emergency state introduced. So this is where the measures were increased again. That's another transition. And the last transition finally was due to relaxation of measures or around Christmas or New Year 2021. So all of these are estimated, and I would like to show you. So that's how it looks like, the model fit, how it looks like the hospitalizations. Again, these are different age groups, and I will show you only, for example, I will focus on the 80 plus age group. So you have this first wave, which was in spring. Then through the summer 2020, there was very low, what I call epidemic activity, when the number of hospitalizations stayed relatively low. Then end of August, beginning of September, there was a start of the second wave. And then with the introduction of the second state of emergency, there was some decline. But at the end of 2020, because of the holidays and Christmas, there was a new third wave starting. And again, we fit to the seroprevalence in different age groups. That's seroprevalence by age, and that's the total seroprevalence. And we estimate how it changed through time until the end of our data. So we estimate that roughly 19% of individuals would be infected by the mid-January 2021. And as I said, in this study, we want to know how the measures are relaxed. How should we relax the measures in the population as vaccination is going on? And so we estimate how the contact structure changes. And here's just a summary measure: average number of contacts in the population, how it changed throughout time. And this solid line is just the median value, and the dashed regions are the confidence intervals. And you see that it started with 12 contacts before the pandemic, then it dropped sharply after the first lockdown. The green lines show our estimated points in the change in the contact structure. So it dropped. Then some of the measures were relaxed in summer, so the number of contacts increased slightly. Then the schools opened at the end of summer and the beginning of autumn, and then it increased again, and so on. And so instead of simulating like very specific measures, I don't know, allowing groups of 5 people or 10 people only outside, or I don't know, allowing to meet elderly at home, for example, and stuff like that, we use these different levels to simulate how the measures needs to be relaxed. So what we are saying is, what if the measures were increased until the level of summer 2020, or what if the measures were increased until the autumn 2020? And we also estimate how the effective reproduction number would change. I will say a couple of words regarding the RE. This is actually the true RE, which is dependent on time. So it's calculated also at a given time point for a given contact structure that we have, but it also takes into account the estimated level of seroprevalence in different age groups. And you see that it started with above 2, and then it dropped, and then through summer it stayed barely below 1, and then increased, and so on. And the control, well, we understand control in 2 senses. So the first is it's a partial control. It's something that, for example, that we have now when RE is smaller than 1, but the control measures are in place. So it's a partial control. And what we would like to know is when RE can be below 1, but we have the pre-pandemic level of contact. So we have returned to normal life. And we implemented the vaccination program exactly as it was announced just before the start of vaccination. It involves, different age groups. It involves different periods. It's composed of 3 phases. And the whole point is that the government plans to vaccinate the whole population, which is 10.8 million, until the end of 2021. And there are also different vaccination categories like healthcare workers and different risk groups, people who have different morbidities in the population, which are eligible from prioritized vaccination. So in our analysis, we modified this slightly because we thought that's not realistic. So we assume that coverage maximum could be 90% in any age group. And surprisingly, there is also data for Portugal, which shows that there is actually very high intent to get vaccinated. The percentage, I think, of people who want to get vaccinated is around 95%. We also assume that children wouldn't be vaccinated because that's not the current guideline. So we don't vaccinate anybody below 20 years of age. The vaccine efficacies are based on Pfizer vaccines. And in Portugal, at least when the study was conducted, the majority of vaccines were distributed by Pfizer, so 95%, and only 2% were AstraZeneca vaccine, for example. That's why also, particularly why I think the opinion of people doesn't depend so much regarding the vaccination, doesn't depend so much on, let's say, on the news about the vaccines, or I don't know, about some side effects and so on. Because those vaccines, they were not actually distributed that much in Portugal. Portugal wasn't lucky in getting them. So we also assume that vaccination, according to our structure, is just a single event. And we assume that the protection that will be acquired, it's equivalent to 2 vaccine doses. And we use pessimistic and optimistic sets of vaccine efficacies. So I will not show all the sensitivity analysis, but we say what would be the best ever situation would be the worst ever situation. And we also looked at 2 different scenarios in which people who get vaccinated don't change their behavior. So the behavior is the rest of the population. So for example, if there is lockdown, they respect the lockdown. Or if the people actually have vaccinated people can change their contact so that they return to pre-pandemic life before the lockdown is relaxed. So so by using this, the data, the actual plan, and the data on the morbidities in the among the Portuguese residents, which is shown on the left. This is just the age distribution of different morbidities like diabetes and so on for different age groups. We project how the vaccination rate would behave during, or would look like during the vaccination campaign. And the vaccination rate is the number of people vaccinated per day on average. And you see that it starts with a lot of red, and red is all individuals who are above 60, but also there is quite some yellow because the healthcare workers would be vaccinated, etc. And this is much more age, has more stratification, but here it's grouped according to, 0, 20, 20, 60 or 60 plus year olds. And then we look also at how the total vaccination coverage would be increasing. And it would be increasing starting from, by May, would be 9% roughly in the population, 38% by 1st of August, and at the end it would be 73% in the population. And we also have projections for vaccination coverage in different age groups. And the data is actually, the actual data is shown in blue and red, where you see that in blue, I show that the number of people, or the coverage for vaccination was 2 doses, which is still lagging behind with respect to the projected, because there was intention to vaccinate a bit more individuals with just 1 dose. So this curve is a bit high, but overall, so far, it's not very different from what we see. And then we had different relaxation scenarios. I will not focus on all of them, but you can check them if you are interested in the preprint. But of course, it makes sense to compare like what would happen if you lift absolutely all measures in the population, then if you lift the measures as it was in autumn 2020. So if the schools are open, but the rest of the restrictions stay, or if we can replicate the measures of summer 2020. Or if you have a stepwise relaxation of measures. And I will just tell you that depending on this scenario, the outcomes, of course, will be very different. So you can either expect a new wave of hospitalizations or may not expect a new wave of hospitalizations. In particular, the best scenario, one of the best scenarios seems to be the stepwise relaxation of measures. So you show in this graph, I show the number of hospitalizations per day, the total number of hospitalizations in Portugal. The red are the data and the black is our projections. There was a period of data where we didn't have data, but where we had to model the epidemic. So that's the third wave here. I can give later the details how that was done. And then we consider the measures. For example, we consider that there are 3 steps which occur on 1st of April, 1st of June, and 1st of October, where the average contact rate of the population would go from the level, would first go to the level of summer 2020, where there are like 6 contacts on average. Then it would go to the level of autumn 2020 when it increases. And finally, on the 1st of October, the measures would be released and we would go to the pre-pandemic level of contacts. And as you can see, intentionally, these times were chosen such that you don't see too many hospitalizations. So the number of hospitalizations stays relatively low here, and it's chosen to be quite similar to what happened in summer 2020, when actually the burden for the healthcare was very low. Interestingly, the effective reproduction number would still increase and would still go above 1 when the measures are relaxed during the step 2 and step 3. But hospitalizations are not increased, but there would be indeed more circulation in the population. But since the most vulnerable groups would have been vaccinated by that point, it already doesn't increase that much, that many hospitalizations in this period. And we estimate that the full control, so when we go to pre-pandemic contacts and when the RE would be below 1, it would be reached in the beginning of 2022. And by that point, we see that 48% of the population would be protected through the vaccination, and 36% would be protected through the natural infection. And just to show you that it's an example, and if you relax the measures too quickly, then you can still get a lot of hospitalizations. Here I show you the example when the third step of relaxation first happens on the 1st of August instead of 1st of October. And you see that at the end of October, in the second part of 2021, there would be still expected quite a big increase in hospitalizations, mainly in younger age groups that have not been that haven't been vaccinated by that point yet. And this was for the most optimistic scenario. In a less optimistic scenario where the vaccine efficacy against infection is quite low, we can see much larger number of hospitalizations, especially during the second part of the year. So if the vaccine efficacy is not high against infection, and also if the people who are vaccinated, if they increase their pre-pandemic contacts too much, then also we can expect much larger number of hospitalizations. I have also examples of other scenarios, but that's a lot. I will not go into all of them. If you're interested, you can ask me. But the whole point is that there can still be, so a lot of measures have to be still taken, and a lot of effort has to be done still to keep the pandemic under control for a country like Portugal, despite the vaccination, to prevent future hospitalization waves. And of course, this work has also several limitations. For example, we have a period where we don't have data, and that's usually a couple of months before we actually the point where we want to be to do the modeling. So we are changing that, updating the model in that respect now. There is no reinfection. Reinfections are happening. They are not that many, but they are happening. And if you want to understand the post-pandemic dynamics of COVID, that's important to include. We also don't include the seasonality. We don't include it because we can't estimate it, so we can postulate it, but we would need some more data on other related coronaviruses, for example. And we also, in the most recent work, we are including also, specifically, we are also including the different strains. Before the different strains, they were modeled, but nothing was estimated. And now we try to actually estimate the selective advantage for the British strain that is spreading and gaining dominance now in Portugal. As you can see, that this is the proportion or the frequency of the British B117 lineage in Portugal. And by the mid-April, it was roughly already 60-something%. So we are also implementing that in the model. And just very brief conclusion. So that if the measures are relaxed too quickly, that we can still have new waves in 2021. And we need to keep a lot of measures to prevent that from happening. In most favorable scenarios, we need to relax measures in a stepwise manner, or we need to relax measures as it was done in the summer 2020, basically when schools were closed. So, and then another option, of course, would be to just increase the vaccination rates drastically. But at least now for the Portugal, that's hasn't happened yet. Doesn't seem to be very realistic. So I think I will finish. Thanks a lot. And please ask me questions if you're still there.
Thank you very much, Ganna. Yeah, people are still there listening. It was a very interesting talk. And I liked actually the dynamics that we can let people think about it and then make questions in between. So thanks for the idea. Normally, I start making questions while people have time to think about it. But I have already a hand here. It's George again. So let's make him a panelist so he can. You may talk now if you want.
Yeah.
Yeah.
Yeah. Yeah, I can say that we are working with Manuel Gomes, and he's very much, he's like our bridge, who is works between the modelers and the Ministry of Health and the minister herself. He knows how to explain these models to people who don't have the training, for example, in modeling and so on. And we also work with them. So now I present mainly the results that were in the paper, but we have done also a lot of work for them just to do in other scenarios. For example, they looked at scenarios and said, yeah, that looks nice, but we don't think that it should be exactly like that. So we think that there should be 3 more steps, for example, and the dates has to be 3rd week of April and so on. So this is, and I think it's quite challenging also to be able to answer all of their questions. But I think if you can at least tell them what is the best scenario, like your best scenario and the worst scenario, so that they can already think better of what could happen. For example, if in all in your scenarios, for example, you don't predict any outbreaks, so very low likelihood of having outbreaks, maybe that can be also used as a message for the policy, makers. So, but if you're not certain, for example, that's what you should say, that that there is some confidence with which we can say that something happens, but it's not certain. Yeah, but
thank you, Sean. Yeah, you can finish, Ganna. Sorry, there's a bit of delay, and I always interrupt people without, intention.
Yeah.
Okay, so we move. We have 2 more questions. Next one is Amit Sharma.
Yes, please.
You have the possibility to talk now, Amit.
Am I audible?
Yes, please go ahead.
Okay, thank you. Thank you, MTB Group, for providing this wonderful platform for students of mathematical biology to learn how the research is happening in these days in this. I don't want to miss the opportunity to be a part of MTV seminar. And I have a basic question from Professor Ganna. And is that whatever little knowledge I have about modeling is that we make a model with proper assumptions and then perform stability analysis on the model, and choosing suitable parameters perform numerical simulation to support analytical results. But nowadays, as you shared, parameter estimation and simulation using real data is the most important part of the paper. So my question is that like a student like me, can I do this individually, or we need a group or a person from statistical background to do all these things? Can you put some light on this?
I can share with you my experience. So I think that in the past, for example, I have been doing modeling for many years since my PhD. And many of my models, it was necessary to feed them to data, actually. Many of the models, you were choosing just like plausible parameters and exploring different scenarios for what would happen in the model and so on. What I learned from this pandemic is that if you work with somebody who is involved in policy making, they want more support for your model. So they want more to know that the model is actually, doing, reproducing the data and so on. So it's agreeing with data. That's why we started to fit these models actually formally to data using this Bayesian inference, because it's not seen as as sufficient anymore to just build SEIR model and look at some scenarios. So that's not sufficient. That's what I learned myself. And luckily for me, I have learned to do also, Bayesian inference. I haven't done this only for COVID. I have been doing already this before, but I think that was really necessary. So maybe, and there are other methods, it's just one method, but people use also particle filtering or Kalman filters and so on to fit models. So I think maybe it would be useful also to work with people who more work also with data and so on for you as a student, I think. And it's always good to learn like new techniques. And then you work with the same models, but you say, well, my parameters, they are estimated by feeding to the model, for example.
Okay, thank you very much.
For your question.
That's what I'm looking for, some expert. And thank you once again.
Yeah, thank you very much. So next question is from Sebastian Contreras. Sebastian, please, you may ask now.
Hello, thank you very much for the presentation. It's super interesting. I have a question, maybe I lost that part. You were trying to model the behavior of people after getting the vaccine, right?
Yes.
Is there any kind of delay, or do you think it is like important to model a delay after getting the vaccine and before being immunized? People is changing the behavior after getting it?
Yeah, in principle, of course, if you would do, let me just open this diagram. So in principle, of course, there is a delay. So some of the vaccines, like for example, this Johnson & Johnson vaccine, it's 1 dose vaccine, but other vaccines, for example, there are also 2 doses. And it should be, in principle, you could make a more detailed model in which you first get your first vaccine dose, then you get some protection, but it's not as good as after 2 doses, then you should get your second dose. And then after only some weeks, you would get your maximum protection that you expected to get, right? And then also the question is also because the chance of reinfection, of getting actually into this box after just 1 dose, it's much higher than, for example, than when you have been fully immunized. So these people, they could potentially also contribute to transmission quite a bit. If vaccine efficacy is not very good in blocking transmission, in blocking infection, so people who get vaccinated, they can still be infected. Maybe they don't end up in the 8th box, but they can still be here. So if the behavior of these people is similar to behavior, for example, of or if they behave as you know, if they have a large number of contacts, they can also contribute quite a lot to transmission. So we have done a quite simple thing. So we assume only that when you get vaccinated, so your vaccine efficacy is equivalent to 2 doses. And we adjust our vaccination coverage based on 2 doses, how it would be projected. And then we have the scenario in which these ID people, they behave in exactly the same, they behave in exactly the same way as, where is that? In the same way as these people. So that's our one scenario. And another scenario is we say that if you're vaccinated, as soon as you get in this SV, IV, IV, RV, or well, here's index V missing, but if you get here, we say immediately if you get vaccinated, you start to feel safe and you have immediately the pre-pandemic number of contacts. So you just behave as like your normal life, you keep on meeting people and so on. And that becomes specifically very important if the vaccine efficacy is not very good. If it's good, then you don't have that many infections, they don't contribute that much. I didn't show graphs, but maybe I can show you one graph. So here's the average number of contacts. It's not split, it's overall in the population. So it's not split after into vaccinated and not. But you could see it if the average number of contacts in non-vaccinated would be, let's say, 8, but in the vaccinated, it immediately goes to 12. So that's what we do in our, that's what we did in our analysis. And I showed just one, I think I showed just one graph here. So this is if you have immediately pre-pandemic contact rates in the vaccinated population, as soon as you move to the vaccinated box, you see that you can immediately start to have a much fewer number of infections and hospitalizations as a result. Did I answer your question?
Yes, thank you.
Okay.
Thank you, Sebastian. We have one question from Beata. Beata, I'm sorry, I'm only calling you by the first name because I don't dare to pronounce your surname. So she asked, Ganna, did you consider stability analysis of your models?
Well, the stability analysis of the models is actually this RE that we are calculating. It's not, so it's, shall I show you? So for here, for example, this value of RE, which is, it depends on all the parameters, so it's just one measure. But then you show that, for example, if RE is smaller than 1, so if you would be in region here, then you have the only disease-free steady state, which would be stable, right? And if RE is above 1, you have only the disease, if you have only the steady, well, okay. Actually don't have, the only steady state would be always having the number of infected people equal to 0 in a model without vaccination. But in the model with vaccine, because it's SEIR model, so that's how it would end up. Yeah, I don't think that I can draw you nicely a diagram as I would do in a in a mathematical modeling framework. But indirectly, we are doing what you're saying. I don't think that I focused on it so much in mathematical terms. But we are linearizing, so the RE is calculated as actually by linearizing around the Jacobian of the deterministic equations that are described in the model. So, and you linearize. In this case, we linearize it just around the state which is given by the number of susceptible at time t and susceptible vaccinated at time t, because we want to know the actual RE. So yeah,
okay.
Not sure
Great,
how not sure how clear that was, but
yeah, Beata just sent a message. Okay, thank you.
Okay.
Great. So is there any more question or comment on Ganna's presentation? I think we are over time. Actually, that was the most productive seminar we had, with a lot of discussion. Thank you very much. Ganna was really interesting. We close now the session for COVID-19, but of course the MTB seminar series still continues every other Friday. The time varies depending on the availability of the lecturer, and we have already scheduled the next 4 seminars, so please join us. And I mean, I would have a lot more questions, and I hope that I can discuss with you.
Did you like the content of this channel? So please subscribe to the channel. It's quite simple. You just have to hit subscribe, and you can decide which level of the notification you want. You may choose all the notification, which means that everything that I do, you receive a notification on your bell here on the upper corner, or you can choose no notification. I would strongly recommend you to subscribe, even if you don't want to receive all the notifications. Just hit here, no notification, or hit the one that you like the most. It's pretty important that you subscribe to the channel, so I can achieve a high number of subscribers, and people can as well understand that this channel has a nice content to offer, and YouTube will understand as well that it can make a nice divulgation of the channel. So please subscribe to the channel.